So a speech therapist is someone who works from the neck on up. So basically our scope of practice is very large. We work not just on speech and talking, but language skills, cognition, which could entail problem-solving skills, memory skills, sequencing tasks, stuff you have to be able to do to return home and complete your activities of daily living safely and more independently. We also do help people who have swallowing disorders. So maybe they have difficulty with solids or liquids, and so we work on strengthening those muscles and making the best, safest recommendation for a diet so they're not at risk for developing aspiration pneumonia or choking. There are a lot of different reasons why people require speech therapy. Sometimes it's due to their cognition changing after with dementia as that progresses. Sometimes people have strokes that cause, weakness on a certain side, left or right. It can affect the language centers for being able to get those words out and communicate wants and needs or understand language to follow directions. Sometimes too, it's just Parkinson's is another good example, or traumatic brain injury can affect cognition as well, and it's things like executive functioning. So it's really a case-by-case basis, but a lot of severe health status changes when someone gets sick would need speech therapy. And as speech therapists, we evaluate and determine what their individualized plan of care needs to be. Okay, so we work on brain function. So like I said, cognitive skills, such as memory, executive functioning, problem solving. We work on talking. If someone has had a stroke, their motor strip may not communicate well with their mouth, so the words may not come out clear, or they may be suffering from dysarthria. So we work on, brain exercises for cognition, working those oral motor patterns to reestablish routing so they can explain what they want and need. Sometimes patients require alternative modes of communication, such as a communication board, and then also doing strengthening for the swallow so they can get back on the safest and least restrictive diet or get back to their baseline where they were before. And for swallowing, we do a lot of oral motor exercises for strengthening the lips and the tongue, and then also vital stimulation therapy is a great way too as well to strengthen those swallowing muscles, and that can be placed in different spots to address different muscles depending on what part of the swallow function was affected.